Welcome to my podcast. Today I'm going to present another case which you could face in the clinical setting. It's non-urgent, so basically, after you introduce yourself, double-check the patient name, date of birth. The patient could be like a student or a teenage who will present with anything in their face that they feel is not nice and it causes like an embarrassment, shame for them. So the patient might have like acne and might notice that the eyebrow on the lateral side started to thin, and the patient is not happy with this, and he thinks it's progressing, and no matter what they do, it's not acting, and otherwise they are fit and well. So from that concept, you'll ask the patient if there is any thought might be their mind for the reason causing this, and if there is any family history, if there is any medical condition that you need to know, could be related, and a family history of a similar thing. And of course, you'll ask the patient that you need to have a close look to see the condition, which could hint out to certain differential. So in this regard, we do see in young age a kind of follicular plugging, and their skin mostly in the face and in the temple area, and also in the arms on the lateral side. I remember seeing those cases a long time ago when I was practicing back home. And the patient doesn't like them at all because they just stood out like projection, basically whitish in color, and it feels hard and palpation. So in this condition, we need to think about keratosis pilaris. However, in the face, there's a condition which is distinctive called keratosis pilaris rubra atrophicans facei. It's a form of keratosis pilaris. It's a rare form. And we do know that it's basically an abnormal keratinization which could lead to scaling that fills the hair follicle and are obstructed, and thus the hair will be plugged, and this will cause inflammation and later on falling, and of course this will lead to fibrosis later on. So the patient might manifest with like an indent, and they're not happy with that. So the whole thing will affect basically in those kind of condition the malar area, forehead, temples, eyebrows, and there is also element of redness around the follicle, which leads to scar-like follicular indent, as I just mentioned, with atrophy and loss of the hair in the affected area. And the keratosis pilaris usually appear or happen in the upper arms. It's kind of sporadic, and it's autosomal recessive mutation due to mutation in a gene called desmoglein 4, and could be in certain situation associated with the syndrome called non. So basically for the diagnosis you need to do a biopsy which will show the whole process of the scaling and the filling of the scale, the hair follicle, which will lead to widened infundibulum, and this will cause plugged hair follicle, which leads to inflammation, redness, and loss of the hair follicle, and of course the intent due to the dermal fibrosis. However, as we all know, there is no radical treatment, but just some measures can be done to minimize and mitigate it. Say, for instance, we need to minimize the scales and the redness. So you will tell the patient you need to use soap-free cleansers, exfoliate with kind of sponges or those kind of stones, what's called pumice. Also, you will use moisturizer with urea, which causes keratolytic of the scales. And so you can have the option of topical retinoid and retin A, also the option of calcineurin inhibitor. You need to tell the patient you need to protect from the sun to minimize redness as well. And there is the element of help of laser, like pulse dye laser and IBL. They could help. And you need to tell the patient this process, the whole process, it will regress naturally after puberty. However, if there is any irreversible changes like the scar things, there's nothing to make it go back. So they might explore certain cosmetic help. And the differentiation that you need to think of here, it's like nutritional deficiency. And this one, there's another condition which you could confuse with because it can cause a recession of the frontal hairline and could affect the eyebrow laterally, which is called frontal fibrosing alopecia, which happen mostly in postmenopausal women. And it's a kind of follicular lichen planus. And also you can think of diarrheal disease. And then you need also to give the information leaflet to the patient in order for them to read about the condition, to understand it. And you'll just tell them there's nothing really serious about the whole thing. It's not something like life-threatening or something. So just need to make sure that the patient understands the whole situation in order to rule out any distress or any concern for the patient, and you just take it from there. So I hope by this I covered this case, which is commonly seen, whether in the pediatric department or outpatient, of course, in the GP clinical setting, and dermatology as well department. You just need to know a little bit about it and treat it as I mentioned, and those kind of measures, and hope by that I covered one of the conditions that you commonly seen in the GP practice. Thank you.